Hi, I'm Dr. Gingeraya, and today I have Jose Rodriguez, who is a medical imaging professional. So I'm going to give everybody your intro, Jose, your bio before we get started. So Jose has served in a medical imaging profession for over 20 years. He currently holds a master's degree in healthcare administration with a focus on quality management and innovation. He has a bachelor's degree of science in radiologic sciences. He's registered with the American Registry of Radiologic Technologists in radiography, computed tomography, and quality management. That's a mouthful. And he's certified radiology administrator and a healthcare finance professional. He's worked in various types of military and civilian facilities, ranging from level 1 trauma centers to orthopedic clinics and surgery centers. And he's held positions from an active duty U.S. Army radiographer to a supervisor and then to a director. So his professional associations include that he served on various committees, boards, locally and nationally, to improve the quality of education, curriculum, standards, regulations, which encompass medical imaging in order to not only promote the profession, but to enhance it. So Jose, thank you for your service. First of all, let me say that.
Thank you.
I want to also say that this recording, this speech, our chat is not endorsed by Jose's employer. It's just him and I speaking freely. And so welcome, Jose. I want to start with the most important question, because I easily get sidetracked by all the cool things that you're doing, is what is it that you do? What is your healthcare career?
So thank you for having me, first and foremost. I
Thank you.
appreciate the opportunity. Um, so medical imaging, right, is essentially that. It's utilizing radiation tools, MRI, sonography to image the body. And I've been doing this 20 years, and I love my field. I I would never look back and select something else, right? So I started out in X-ray, like most of our technologists do. We have multiple primary pathways, which means you can enter the field in X-rays, doing X-rays, or come in through MRI or do sonography. Um, and then from there, there's various ways to branch out. But I started uh, doing X-rays for the military, actually.
Awesome. So what kind of training did you need for that, Jose?
So generally, the X-ray technologist entry-level program is a 2-year associate with most of the time some prerequisites. There's some trade schools and stuff that you can get in through as well that are accredited, that you can earn your national registries through, and that's absolutely fine. Or you can go the military route like I did as well.
Awesome.
Um, yeah.
Okay, so for a lot of people that are considering healthcare, I find that when I talk to people, they're very discouraged about the process of getting in. And for you, I mean, did you go into the military and then discover, like, okay, this is a cool field, I should do this? Like, why imaging? Why medical imaging for you?
So I knew early on I wanted to go into healthcare at some point, right? Like a lot of people do. And I just wasn't sure what area, whether it's therapy or whether it was nursing or whatever. And I had actually, when I graduated high school, went to stay with my sister and her husband, who was military, and we would walk around the clinic and we talked to a lot of associates about their jobs, and I would ask them, like, if you could do it all over again, what would you do? And 9 out of 10 said I would have gone into radiology, right? I would have gone and done these guys. So I went and talked to the radiology tech, and he told me the exact same thing. I love the field. This is what I do. He worked at a clinic, but there's, I mean, I could spend hours telling you, like, there's so many different pathways that you can get into X-rays just to start. It's just the very beginning. So it was very broad, and it was very easy to say, yeah, this has so many options that why wouldn't I go this way?
So then you select medical imaging, right? You start with x-rays. At what point do you feel like do you start like formally leading a team? Like, and I think when you're in the industry enough, there are those of us that, choose to lead, and there are those of us that are like forced to lead. So can you describe how do you then go into leadership within medical imaging?
Yeah, and so medical imaging is a very interesting field when it comes to leadership because it's really facility dependent and region dependent, right? Some areas, depending on what the market looks like, you could end up in a supervisor or even a director position in the first couple of years, right? Especially if you're in a lot of those really remote areas, and there's not a lot of technologists available, especially here in Texas, right? You run into that a lot. You work at a rural hospital, the director retires or finds another place, and they have trouble recruiting, so they end up hiring a director from one of the supervisors that may have only been there 2 years. So it is an interesting field when it comes to leadership dynamic because you can be thrown into those roles sometimes. But in the larger areas and more populated or larger healthcare systems, usually they do require advanced education, bachelor's degrees and master's degrees in order to fill those roles because they're very large encompassing roles. Most directors will manage millions of dollars of equipment and millions of dollars of patient throughput and revenue.
Which explains why you also have that healthcare finance focus, right?
Mm-hmm.
It makes sense. So my third question was really about how long it took you to find the right role. Like you get into x-rays, like, at what point were you like, this is maybe not enough, but like, at what point do you say like, okay, I'm on the right track. Like this feels like the right career path.
For every individual, it's different. And myself, I loved radiology before I started it, and then I entered the field, and I've loved it since. I knew I wanted to go into leadership. I was in a lot of leadership roles when I was in the military, so I knew that was just the direction that I wanted to head in from the very beginning. So yeah, it was a pathway for me.
Awesome. So what advice would you give to healthcare students or early careerists, or even people who are in healthcare, but they feel like maybe it's the wrong like sub industry for them? Like what advice would you give them?
I mean, unfortunately, you just really have to find your passion. You have to really just enjoy going in every day. And that's why I like radiology as a field. I recommend it to a lot of students, high school students, when we do career fairs and things like that, because it has options, right? And without getting all the specifics, you can come in and you can work in X-ray, and you can work in an orthopedic clinic, you can work in the OR, you can work in a busy level 1 trauma center, you can work at a private oncology office. I mean, the field itself is so versatile, and that's just X-ray. And then you can branch off into imaging informatics, which is, like the IT side of things. You can branch into management, you can branch into teaching, you can branch into CAT scan, which is a whole nother modality. You can branch into doing MRI, which is a whole nother field. And it's just one of those fields where if you get in, and some people stay in X-ray for 40 years. We had, I knew a buddy of mine who retired, he'd been doing this for 45 years, and
yeah,
it was his passion. But you can always move out of it.
So something I recommend to students, and I want to talk about your professional association experience, and I want to talk about how you got into that. But something that I recommend to early careerists and healthcare students is that they join associations, right? Professional associations. So if they're not sure, like maybe it's MGMA, maybe it's ACHE, because I feel like if you have a strong chapter, there's networking events, right? And maybe like you feel things out that way. If you really don't know what you want to do, maybe you do internships, maybe you do, fellowships. So I want you to talk to us a little bit about your experience with professional associations, why you joined that association, and what path it's led you to first.
So yeah, professional associations I think are just so important. So interesting enough about medical imaging, our field is very, very competitive to nursing, right? And when you look at
Wow.
scope of education and scope of practice and the things that radiologic technologists do versus nurses, it's a very similar, but it would, I guess I would consider it more of a specialized type of nursing, right? Because
Okay.
we can there's certain medications, we do patient evaluations, I mean all that sort of thing, and a lot of people don't realize that. Now, the problem is because it's so specialized, sometimes it isn't as widely known or as widely advocated. Like, as there's millions of nurses with associations that advocate for, allowing nurses to do a lot of different things. And being a more specialized field, we don't have that level of advocacy, right? So
Sure.
it's very important to be involved and to really get the word out because, the public, doesn't always know, and a lot of even peers and healthcare professionals don't know what medical imaging techs do, and allowing them to understand, you know, what we do as a profession is just so important. And
Yeah.
it, you know,
So then how did you get involved with your association?
so I've always been the type of person that says somebody's got to say something, and I'm going to go say something. I mean,
Awesome.
somebody's got to do it.
Yeah.
So I try to get involved, bring opportunities to, being in the El Paso region. Sometimes we're part of Texas, but not always part of Texas,
Mm-hmm.
uh, our way. So I wanted to bridge that gap. I got involved with our state society and really just tried to, make sure that the El Paso, the West Texas voice was heard as part of the state of Texas, because we are.
Awesome.
And I served with the state society as a regional counselor. I covered the area for a couple of years before I moved into vice president role, and now I took over as the president this year.
Congratulations.
Thank you.
So you're recruiting people to like join the association? Do you guys offer like continuing education, like those types of things?
Yes. So we do hold our annual meeting, and we offer continuing education opportunities for technologists. Of course, the ability to network. We try to do a lot with our students as well, to make sure that we're pulling them in and engaging them, because we want to have them show them the value of what being a member of a society is and what it really means.
Yeah. I saw your meeting was in Nashville, right? So I almost joined your association to go to that annual meeting.
That was
But
glad.
something that you said right now is that it's very competitive, right? And so, as someone who's in healthcare, I can tell you, like, we feel all kinds of staffing shortages, right? And I can't imagine how tight the market is or how high the demand is for imaging professionals. I mean, can you talk about how hard is it to recruit people? And by saying that, trying to advocate for people to look into that specialty because you can get a job, right? Like you can get a pretty good job. Can you talk about that?
Yeah, so it of course it varies by region, right?
Sure.
Some states may have more schools than others, and
Yeah.
um, and some areas may be more heavily populated and able to find more technologists. But generally, yes, there aren't enough technologists nationally to keep up with the growing demands in healthcare and the number of facilities that are growing. So, and I know Texas is definitely one of those where we struggle trying to find enough qualified technologists to fill our, you know, our centers.
Okay.
So
So it's a good job market then.
there is a good job market for it, absolutely.
And if you can talk in general terms, Jose, like what kind of salary can people expect from, like, let's just say a new, somebody new to the industry?
hmm Generally, again, very regionally
Sure.
dependent, but
Of course.
but generally, most technologists will start off entry level somewhere between 19 and $30 an hour, depending on the region. Now, you go to like California, I mean, you can double that.
Sure.
But
Sure.
yeah, but it's definitely, like I said, a very specialized field. Again, have a little trouble trying to remain competitive in the market with so much push for nursing and things along those lines. So
Mhm.
you get get left out, where it's where that advocacy piece comes in.
Yeah. Okay, very good. I think those were all my questions, Jose. Thanks so much. Is there anything else you want to say about the industry, medical imaging, before we wrap up?
No, just like I said, that it's a very, very versatile field, and there's so many avenues that you can go through, and just coming in as an entry level person, a lot of people love it and stay in that without even having to go forward.
And I mean, it sounds exciting, like, patient care, I'm sure there's a lot of situations where someone, would never be bored, right? This isn't an industry where you're probably not bored.
Not at all. And then with the advancements in technology moving so quickly, I mean, we're just seeing more amazing stuff every couple of years. Something comes out, and we're wowed by it.
Wow. No, that sounds awesome. Well, thanks again, Jose, for speaking to us. And I'm going to include Jose's LinkedIn profile, his URL. You're welcome to connect with him. And if you're interested in learning more about imaging, I'm sure Jose can give you some insight.
Absolutely.
Thanks so much, Jose.
Thank you.